Hey friends, today we're going to look at airway management skills for the new nurses or new grads that are entering into the peri-anaesthesia area. Welcome back to my channel. If you're new here, my name's Rory and I'm a clinical nurse specialist and a clinical nurse educator living and working here in Newcastle, Australia. On this channel, we discover and explore the strategies and tools you can utilise within personal development and education to become the best version of yourself. Okay, when I started my new grad, I went straight into the recovery unit or the post-anaesthetic care unit, and the first thing I noticed was that they're managing airways all the time, and this was very different to what I'd seen and what I'd experienced when I worked and had student placement in an emergency department. So familiarising yourself with the equipment that they use around managing airways and familiarising yourself around the knowledge of airway physiology and anatomy would be very helpful before you get into the recovery area. Now, when you're in the recovery area, there's a few skills that you can utilise straight away off the back to start to get involved in airway management and start to develop your skills and ultimately start to become a recovery nurse. Because like every patient assessment, we start up at A. Okay guys, let's look at some specific skills that we can use straight off the bat when we get into recovery to get involved in airway management and really start to build our confidence in the skill of providing that such vital care that they do as recovery nurses. Alright, so we're going to look at a few skills that are involved in airway management here. They are chin lift, jaw support, head tilt, and jaw thrust. The use of non-invasive devices to manage the airway like oropharyngeal and nasopharyngeal airways. The differences with adult and pediatric airways and the management of those airways. And appropriately managing patients that are affected by anaesthesia. So if they're variously conscious or not really communicating, positioning them appropriately to support their ventilations and their circulatory function is absolutely imperative. And then a quick mention to the good old LMA and intubation. Okay guys, I'm here with my mannequin Braden. Okay, we're going to show a few airway skills utilising Braden, and a few things that I noticed when I first went into recovery was that they manage things a bit different to they do say in like the ED, where in recovery they're affected by medications, they're a lot more variably conscious, and there's a lot more different things happening and they've got a lot more different things to manage airways. So in the recovery setting, a lot of their patients are actually lying on their back. When they first come in, they might need to emerge from their general anaesthesia, they might stay lying on their back, but they might end up sitting up. Okay, so they're not completely flat, they're sitting up to support their breathing and also to hopefully let them wake up and then progress on and out of stage 1 recovery. For the best for someone is on their side. People breathe better laterally. So this is what you see probably more in the ED due to trauma and blood and other things going on with other areas of their body. But in anaesthesia, you tend to have them on their back. So positioning in terms of high Fowlers when they're waking up and becoming more conscious is so important and so good to do for their respiratory function. A couple other things. We use a few non-invasive or minimally invasive devices to maintain someone's airway, and they are a nasopharyngeal or an oropharyngeal airway. Now, as a recovery nurse, you don't a lot of the times have to put one of these in. With a bit more vigorous support and appropriate clearing of the airway, with enough time, patients usually don't require anything like that. And I'm a bit more of a less is more approach type person, and there's a lot of damage you can do with inserting a nasopharyngeal and an oropharyngeal airway. So it's always good to make sure that someone absolutely needs them before you're actually going to put them in. If worse comes to worse in a recovery unit, you always need to be prepared to put an LMA in. Now, it's not technically known and called as intubation, but rapidly intubate. You need to be prepared to put an LMA in if someone has a sudden loss of their airway again, or they lose their optimum respiratory function and they need some support of that and they're not that conscious. You need to be prepared to put an LMA in. And also, it's always good to have some sort of urgent or emergency intubation equipment available straight away in recovery, just in case an anaesthetist needs to come out and do what they need to do to intubate or re-intubate a patient. Okay, in terms of adults versus pediatrics, I'm not going to go too much into it, but basically pediatrics or infants through to your children have a growing, developing airway, which largely means that they don't require as much head tilt or extension with the management of their airway. They just need chin and jaw support. So this is something to consider and something to be mindful of at A. When you go through to B, obviously their lungs aren't as big, so they don't need as big a volume as of breath, and you need to be mindful exactly how you're ventilating them. So that's all I'm going to say about pediatrics versus adults, but just be mindful they are very different. They're not just little adults. Okay, let's jump down with the mannequin and we'll have a look at the specific skills that I just mentioned. Starting with number 1, chin lift, where you support the lower jaw up in the air so it doesn't go down onto the airway, occluding the airway and making or compromising respiratory function. Number 2 being head tilt. Okay, so head tilt, head extension, very important with adults to assist in the patency of their airway. That in combination with chin lift in a just unconscious patient can be quite useful. Number 3, you might need to have your head tilt with some jaw support, okay? So just supporting the whole lower jaw more vigorously, okay? But then the most important is jaw thrust, number 4. It is a very, very important skill. And if you get, I do it with my two middle fingers, but I put it in, you put it in here just behind the ear. If you actually do it to yourself, it hurts because you're conscious and you can feel pain. But for them, they're unconscious, they can't feel pain. So if you tilt their head back and you stick your fingers in that point and you push the jaw up towards the sky, so you're not pulling the head further back towards you, you're literally pushing the jaw under where you've got your finger in there up towards the sky, and that intense jaw thrust lifts that lower jaw right off that airway, and it is also a very, very stimulating maneuver to do to check for response and also for them to optimize their respiratory function, especially if they're still affected by medications that is changing or affecting their level of consciousness and respiratory function, and you're trying to optimize their respiratory function to keep them safe. So those 4 skills are very important, and in combination will give you a great setup ready to tackle your time to learn airway management in recovery or in anesthesia when you get there. Alright guys, if you enjoyed this video and you liked seeing these skills performed on Braden, please give this video a like, subscribe and see what else comes up from this channel in the future, and we loved staying here with you guys and showing you some stuff about airway management, and I wish you all the best in your journey in peri-anesthesia. Thanks guys, see ya.